Hi everyone, thank you for joining my meeting. We're here to talk about workplace hazards. Something happened over the weekend on third shift that I would like to recognize and acknowledge, and I feel like we need to have a staff meeting to prevent it in the future. So if y'all could hold on tight for about 25 minutes, and that'll all I'll take of your time. I'll try to hurry as quick as I can, but we're gonna go over what needs to be talked about so we can remain the safety of our staff and our patients on rehab floor. Now, before I explain exactly what happened, I just need to clarify that we know safety protocols in store at our facility, and I want to explain what a workplace hazard is and to remind you so we can help prevent it in the future. Workplace hazards can be defined as any source of potential damage, harm, or adverse health defects on something or someone. And that's an article written by Martinelli in 2019. They are avoidable with proper training, hazard identification, and the use of proper staffing. There are certain types, such as chemical, physical, safety, and psychological. As a healthcare worker, it is important to acknowledge these safety problems as they occur and try to better them in the future. A big thing is safety. In nursing, they always tell you safety is a first priority and to stop the mode of infection. Well, over the weekend, it was brought to my attention that third shift, there are some things being done that are not safe for the staff or the patients. We had a patient up unassisted, tripped and fell over an area rug, and also managed to grab these nice little nursing scissors that were left out on a med cart. A med cart that was also not closed, in which the patient, luckily they did not grab any medication that was not theirs, obviously. So, a lot of red flags there. You cannot keep your eyes off of these patients, especially on third shift. We have sundowners, we have the people that do not want to comply. But you gotta, remain safety as much as you can. Think about what these patients come in for. A lot of them are rehab and they need to go home and, resume daily lives as soon as they, get better with therapy for whatever reason they're here. But you also have to keep in mind that, they're in our facility now and we have to keep them safe. We are their eyes, hands, we're here for them. So, check on them more often, especially third. There's a higher prevalence of falls on third simply because a lot of patients are taking medications to help them sleep. A lot of them, like I said, are sundowners. So it just depends on the person, but it's important to keep on top of these patients and to constantly check on them, to keep an eye on all your patients to make sure you're doing the best you can to care for them. I know it's a fine line between keeping them awake and wanting them to sleep and checking up on them, but just try to be as quiet as you can. Explain to the patient that you're only trying to do this for them and that you don't want them to get up because they have to use the restroom and accidentally fall, because that does happen. I just want y'all to be proactive. Was their bed lowered? Did they have fall mats? That seems to be an issue nowadays, especially at our facility. We're getting more and more patients with, said dementia who, get up unassisted, and, some of them are, happy-go-lucky, just wander. Some of them, get hostile and want to throw punches. But it's important for us to try to do all the safety things we can before it gets to a point where, we have to call an ambulance on them for, something really bad happening, like maybe they fall and crack their head open. You don't want anything like that to happen, so it's important to prevent all of these. Like, was the bed lowered? Were fall mats put down? Was there anything on the ground else that could have hindered them from walking? Did you teach effective call light usage? It's important to not teach that only on third, but to teach it during the day too. While they're not on those sedative medications, you can be teaching during the day too to help, clarify any misconceptions. Do they have to use the restroom? Are you checking up on them? I know the CNA come up to me and told me what had happened, and she said that she was just in there, and the patient said that, they had just swam, but they had to go again, so they got up and tripped over the area rug in their room, which we shouldn't have area rugs in their room to begin with, but I think a family member put that in. So we'll have to educate families on that as well, that it is a trip hazard, and we would have to remove it promptly. But as I remind you, I'm aware that nurses are often left in situations that are hard to manage, especially without the appropriate equipment readily available concerning our floor mat issue. Those are set to prevent injury to the patients, and that is our job to supply those. And that will be in our continued plan of care. Another solution I would like to clarify is that if something is not working correctly or there is not enough of, it is important, whether you're a CNA, a nurse, please let the supervisor know, as well as putting it in the maintenance book, whether it's, getting more supplies, whether it's checking possible faulty equipment, whether it's acknowledging faulty equipment. Those are things that need to be acknowledged and fixed as soon as possible to prevent patient or staff harm to anyone. Just kind of jump the ladder a little bit in the chain of command and kind of just, make sure everybody knows that, because that is a big issue. We have to protect ourselves and protect our patients, especially when it comes to lifting. Whether you're using a Hoyer lift or whether you're using, your own body mechanics, it's important to not overstrain yourself like a nurse did that I was told recently, throughout her back, because she was lifting heavy patients improperly by herself. And it is proper protocol that you take in another aide to help you, whether it's a nurse or your aide or an aide and another aide, whoever. There needs to be 2 people in the room at all times to help transfer a patient, just for safety measures. The nurse is okay, but still, that's something that needs to be addressed and reminded. Never go in by yourself. Go with someone else as a means for safety and just, overall cooperation between the nurse, aide, or the patient. Safety hazards can be defined as an unsafe working conditions that can cause injury, illness, and death. Safety hazards are the most common hazards in the workplace. That is an article from Safety Line Lone Worker in 2017. Examples of safety hazards are anything that can cause a trip or fall, say said floor mat, spills, something on the floor, slippery substances, things that are on the floor that shouldn't be, electrical cords. We've got to find something better to do. If you see something that's incorrectly placed, if you have the time, please fix it, or at least acknowledge it and let somebody know. You know, timing is essential, and it needs to be perfect, because it can affect the nursing staff, you know, and patients. You don't want slipping and falling. We need our nurses and our patients safe so we can, you know, help with what everyone's here for. I mean, we have to look out for all and every one of us. We're in this together. So, like I said before, you know, there are improper and proper working, lifting techniques for heavy objects, whether it's equipment or a patient. Not caring for patients at a proper working height is not good. You want to raise the bed for your comfort. You want to remember to lower the bed once you leave. You need to make sure that you're not working in an awkward position, and that's not good for body mechanics in general. So make sure you're aware of your body position during certain movements. That seems like oh, of course I would do that, but you'd be surprised at how often people get themselves stuck in a situation they can't really get out of. And I would also like to remind you to, in regards to that, never leave yourself cornered in a patient's room. If you can, and I recommend this, have your back facing the doors to where you can get away from the patient. Here on rehab, we have had dementia patients that, you know, like to take a swing or like to throw things. It's important to, you know, stand on guard and, you know, watch your surroundings and make sure you have, you know, a getaway, so to say. Another big problem, and I've noticed it walking around. I try to make things easier on everybody as I make rounds. Nurses, there is a stand on your workstation where your med card is. You can actually move the monitor up and down to your height. You don't have to be looking up or looking down and squinting. So you can adjust that. It is adjustable. I just wanted to let you know. Because, you know, you need to have your equipment at working reach. It's important to maintain very good body posture, shoulders back, high, don't be slouching, don't be sitting on one hip, you know, try to maintain good body mechanics. I know working through that's very hard. We're all just a little tired. Try not to perform tasks when stooped over, trying to lift things that are out of your reach. If you need help, please get it. I know it's hard on third to get help, but call and ask. We'll get somebody to help you. As nurses working on third and CNAs, I'm talking to you guys too. It's important. I recommend wearing compression stockings. It helps with fatigue and prevents blood clot formation, so it actually increases the circulation in your legs, and it helps you not be as fatigued, tired. It is also now a new requirement to have non-skid shoes. I know we're kind of lenient on third, but I would like to highly recommend that you wear non-skid shoes, closed-toed. You can wear any type of socks, just closed-toed, non-skid shoes. Like I said, that's to prevent injury to you. That'll help, you know, any injury maybe a patient is involved with, maybe, you know, not slipping when you are trying to brace a patient of a fall can, you know, help that patient, you know, with safety, like nothing happens to them. That's our goal. So, you know, that's another recommendation I have. So like I said, the goal of nurses, healthcare workers in this facility in general is to maintain the safety of our patients and our staff. So these surgical scissors that were left on a med cart, please keep those in your pocket. You know, thinking on third, you think that, my patient's going to stay in their room, they're going to stay in their bed, and we don't necessarily think that they'd go after a pair of surgical scissors. They're just scissors, right? No, they could potentially use that as a weapon, and that is a big, big safety risk. Also, locking your carts. Please lock your carts. That's a nursing 101. We know this, guys. Lock your carts immediately before you walk away. We do have patients that get up in the middle of the night, and they're not always coherent. So, like I said, safety is a top priority. We do not want them ingesting anything that is not theirs, anything that they feel free to. It's not ideal. Then we have to get families involved, and it's not a good time. But safety is top priority. According to National Nurses United in 2019, nursing supervisory staff should then be able to determine if extra staff is needed based on unit census or working conditions, and should have the ability to allocate staff members to the areas that staffing is needed, and also taking into consideration the well-being and overall health of the staff. When there is a lack of appropriate nursing staff, patient care drastically suffers. There is a higher likelihood for patient deaths, staff injuries, medication errors, transmission of infections, misdiagnosis, lack of appropriate patient monitoring, improper enforcement of treatment plans and guidelines, lack of discharge planning, and lack of education time, which increases patient recidivism. We are aware that on third shift, there's not as much staffing as there would be on first and second. We are trying to improvise with that. Right now it's very hard, especially with COVID hitting us right now. There's really not a lot we can do. We're doing the best we can, and if y'all could stick it in with us, we would greatly appreciate that. We are all in this together, and we will provide everyone support and anything they may need. So our plan of action is just to remain as much safety as we can, whether it's lowering beds, putting fall mats down, adding non-skid stocks to every patient, teaching them about the call light, not only during nighttime but at the day, reinforcing signs on the walls, periodically checking on them more often, answering those call lights. Big issue. Guys, I know there's certain times, especially during that morning med pass, those call lights are crazy, but we have to get them knocked out. Provide patient injury, provide personal adequate care for each patient, high priority. And I would like to remind the nurses that it is okay to delegate. Don't feel like you have to do everything on your own. I like to say on third shift we do everything, as one, as a family. I consider us our third shift family. We are really all in this together. So if you need help, please ask. Whether you're delegating, whether you're helping, whether you're all the same person for the same night. There are nurses that do CNA work, CNAs that go above and beyond. Just trying to do the best you can for everyone as you can. If you see someone struggling, please go in and help them. CNA, nurse, I don't care who you are. We are in this together. We need to get it done. So it's okay for the nurse to delegate to the CNA to do something, but the nurse also needs to be acknowledgeable that, my CNA may need help. I should maybe go help and see what they need, if there's anything I can do for them, just to make things run smoother. Because as a nurse, when your CNA is doing great, things are going great, it makes your job so much easier. I know we're stressed out. I know this is a hard time. This is a pandemic. We're all affected, and we're all trying to hang in there so much. If you could just try to help us in the safety aspect, things should get easier. This is a terrible virus. We have to maintain safety to maintain the infection. We're trying to get a hold on it. We're trying to get vaccines. We're just doing our best we can to maintain the safety of everyone, to keep everyone healthy. We're all worn out. We all have emotional battles we're dealing with on top of this pandemic, on top of work. It's hard not to take it home. It's hard not to carry the weight of the world on our shoulders, but it's important as nurses to remind ourselves while we're here, while we're doing this, what we're doing, and how we can stop the mode of infection with safety guidelines. Ethically and spiritually, there's also been some concerns about nurses of different ethnicities and of different backgrounds interacting with their patients that are not of the same of their own. It is important, if you're unsure, to ask your supervisor. Interpreters are great. They really are. You can use those. You could also ask the patient and their families how they perceive certain illnesses, what they believe in, what they don't believe in. Not everybody uses the same terms. Not everybody understands the same language. There may be barriers. There may be education barriers. Maybe this patient can't read what you're trying to give them. Maybe there's a barrier and they're too embarrassed to ask or to tell. It's important that you pick up on those nonverbal cues to let you know that something is wrong. But like I said, a main problem with us right now is, the use of an interpreter. They are highly, highly recommended. They are at your disposal, and I highly recommend those just as a reminder. So with my final thought, I'd like to say thank you for taking the time to listen and to acknowledge what I've had to say and remind you guys of. We want to maintain safety, so nothing can be said between the patients and their families. It is a hard time right now. Families are not allowed to come in, and we need to have safety in mind so patients are not falling and we are not possibly getting sued because of a fall that should not have happened. It is best to prevent things like that for obvious reasons. The priorities are keep the patient safe. Whatever you can do, lower that bed, put fall mats down, non-skid socks, call light. Do whatever you can. Go above and beyond for your patients, like I know you will, and you usually do. I will work on getting more floor mats. I do apologize, and that was brought to my attention. We will fix that. As far as anything else I've seen, please pick up your nursing supplies, close your med carts. Bring things to your level, bring the beds to your level, lower the beds back down to the patient's level. Try to make things easier on yourself. I know that we feel that we have to be in a hurry to get things done, but if we take the time to not make things hard on ourselves, it could make things run smoother and make us to where we're not fatigued, not tired, and not hurt. We have to take care of these patients. We have to get them better, but we have to work on ourselves too. And if we're broken, we can't help the broken. So keep that in mind. Keep up the good work, guys.